The Honorable Minister of State, Cabinet Secretary, Directors of the Federal Ministry of Health here present, ladies and gentlemen. We said that we shall provide updates on the coronavirus epidemic or pandemic as it is now to members of the press so that you have the full, correct and authentic information, so that you also avoid fake news and misinformation and rumors. On the 19th of March 2020, 4 additional cases of coronavirus disease were confirmed in Lagos State. This brings the total number confirmed in Nigeria to 12. Of the 12 confirmed cases in country, 9 were reported in Lagos, 2 in Ogun State, and 1 in Ekiti. Nigeria is experiencing an influx of imported COVID-19 cases by travelers, including, unfortunately, also returning Nigerians. And this emphasizes the importance of self-isolation for a minimum of 14 days, even if you feel that you are very well. 8 of the 12 cases are travelers from Italy, the United Kingdom, the United States, and France. And 3 cases are contacts of the imported case, and 1 case confirmed yesterday has no travel history at all within the last 1 month, but may have met with foreign visitors. The Nigeria Center for Disease Control is working closely with Lagos, Ogun, and Ekiti state governments to carry out contact tracing. I emphasize that the contact tracing is an extremely important but also arduous task, and I urge all state, local government, law enforcement authorities, and community leaders to give full cooperation to investigators. Following the declaration of a pandemic by the World Health Organization and the increasing spread of COVID-19, our strategy is to detect and isolate new cases as early as possible to interrupt or reduce transmission of infection. To this end, we have scaled up our response efforts, and to reduce the risk of new cases entering Nigeria, the government, through the Presidential Task Force on the Control of Coronavirus, announced prohibition of entry for travelers from 13 known high-risk countries. And for better control of new arrivals, international travel to Nigeria has been temporarily limited to 2 international airports: Murtala Mohammed Airport, Lagos, and Nnamdi Azikiwe International Airport, Abuja. Port health services will be strengthened at these airports. Other airports shall be closed to international traffic, but not to domestic traffic. These decisions will be reviewed as the situation demands. Travelers from all countries shall be required to self-isolate for 14 days after entry, following the guidelines provided to them. Non-compliance puts your family, your friends, and the public at risk, even if you feel very well. As for arrivals from high-risk countries named, their self-isolation shall be supervised in the form of follow-up to be conducted by Port Health Services and NCDC, with the option of doing the testing as need arises. According to our national case definition, we have identified 2 more high-risk countries, Austria and Sweden, who were added in the past 24 hours to the list. We are also including COVID-19 testing in our routine surveillance for influenza-like illnesses. The original index case is clinically stable and has improved greatly. The first test, negative test, was recorded yesterday. We will discharge him if his next test is negative according to the case management protocol. Therefore, as of 20th of March 2020, Nigeria has recorded the 12 confirmed cases of COVID-19. One case has been discharged from the hospital. The other cases are clinically stable with only mild symptoms. Contact tracing is ongoing to identify all persons who have been in contact with the confirmed cases, and it is estimated that there are about 1,300, and they are going to be traced. Port Health Services of Federal Ministry of Health, in collaboration with state ministries of health, have heightened screening at all air, land, and sea points of entry into Nigeria, and adopted the protocols to reflect the travel guidance issued by the Presidential Task Force for the Control of Coronavirus. The Federal Ministry of Health is working with Nigeria Customs Service and Nigeria Immigration Service to ensure surveillance at land and sea borders. Ships coming in through the seaports are also subjected to mandatory health screening and clearance by Port Health Services, especially ships that sailed from high-risk ports and who have been at sea for less than 14 days or have crew members who are known to have fallen ill. The Multi-Sectoral Emergency Operations Center, led by NCDC, continues to coordinate national response activities. Various states have implemented measures to shut down schools and large gatherings. But however, we must now begin to emphasize the importance of personal responsibility by citizens. I want to say again that those who have just returned from overseas travel will be doing themselves, their families, and the country a great favor if they stay home in self-isolation for 14 days, during which they shall report their health status daily to NCDC on phone numbers provided. This number I will give to you later. But it is to be done whether you have symptoms or not. NCDC published a guidance on self-isolation with clear steps on what to do to stay safe and keep your family safe. We urge Nigerians to wash their hands, avoid contact with people who are sick, and practice proper personal hygiene. Follow the NCDC published guidance on self-isolation. It has clear steps on what to do. NCDC hotlines are active day and night, and we urge citizens to only use this for legitimate reporting and not as a joke. Answers to frequently asked questions have also been put up by the Presidential Task Force on that website. We are continually scaling up the capacity. We applaud the efforts of Lagos, Ogun, and state governments, and Ekiti, Lagos, Ogun, and Ekiti state governments in implementing urgent response activities, and urge other states to do the same if and when this need arises. At the National Executive Council, chaired by the Vice President this week, I urge states to urgently scale up investment at subnational level, especially in contact tracing and usable emergency isolation centers. Citizens are advised to discourage misinformation that causes fear and panic and not to participate in disseminating false or senseless messages, even if they seem funny. Please accept only information shared through official channels of the Federal Ministry of Health, the NCDC, or state ministries of health. The fight to contain COVID-19 is a call for every Nigerian resident to be responsible with information by accessing and sharing only credible information from the official Federal Ministry of Health, NCDC, Lagos State Ministry of Health, and other state health department officials or channels on TV, radio, and social media. NCDC has a website focused solely on COVID-19. This website is updated daily and has all the information needed, including daily situation reports, guidance for schools, guidelines for health workers, and more. The website is covid19.ncdc.gov.ng. Advice for self-isolation. If arriving the country, ensure that you are picked up by only one person, and you should try to avoid the use of public transport, whether by plane, bus, train, or car. Do not sit in the driver's seat. Maintain at least 1 meter distance between yourself and the driver. Ensure adequate ventilation throughout your trip. Avoid contact with the driver. Do not leave your house during self-isolation period. As much as possible, stay in one room. You should strictly limit your contacts with people, even including family, during that period. And if during your 14-day self-isolation you develop symptoms of COVID-19, such as cough, fever, shortness of breath, or generally feeling unwell, avoid self-medication and contact NCDC through the Connect Center immediately. The number is 0800 97000010. I shall repeat, 0800 97000010. Once again, I wish to urge all citizens to take care of their health and protect others by continuing to do the following. Regularly and thoroughly wash hands with soap and water for at least 30 seconds. Do not, and if not possible, use the alcohol-based hand sanitizer. Maintain up to 2 meters, at least 2 meters distance between yourself and anyone who is coughing or sneezing or has a fever. Be sure you and people around you follow good respiratory hygiene, which means to cover your mouth and nose with a tissue or handkerchief if coughing or sneezing, and dispose of it immediately. Alternately, use your sleeve and cough or sneezing to it if no tissue is immediately available. Do not mingle with people or to congregate, but instead stay at home if you feel unwell with symptoms like fever, cough, sneezing, difficulty in breathing. Call NCDC, a toll-free number available 24/7. Thank you for listening.
Thank you so